What is diabetes? Complete information. What is diabetes? Diabetes is a chronic, long-term medical condition in which the body cannot properly regulate the level of glucose, blood sugar, in the bloodstream. This happens because the body either does not produce enough insulin, does not produce insulin at all, or cannot use insulin effectively. Insulin is a hormone produced by the pancreas. Its main job is to help glucose move from the bloodstream into the body's cells, where it is used for energy. When insulin is not working properly, glucose builds up in the blood, leading to high blood sugar, hyperglycemia. Over time, uncontrolled diabetes can damage many organs, including the heart, kidneys, eyes, and nerves. Types of diabetes. 1. Type 1 diabetes. Type 1 diabetes is an autoimmune disease in which the body's immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. Key facts: usually develops in children, teenagers, or young adults, but it can occur at any age. The body produces little or no insulin. People with type 1 diabetes require lifelong insulin therapy. It cannot currently be prevented too. Type 2 diabetes. Type 2 diabetes is the most common form of diabetes. In this condition, the body becomes resistant to insulin, insulin resistance, and over time, the pancreas may not produce enough insulin to keep blood sugar under control. Risk factors: being overweight or obese, lack of physical activity, family history of diabetes, older age, unhealthy eating habits. Treatment: healthy diet, regular exercise, weight management. Diabetes medications, insulin, if needed. 3. Gestational diabetes. Gestational diabetes develops during pregnancy in some women. Important facts: usually disappears after childbirth, increases the mother's risk of developing type 2 diabetes later in life. Rick's careful monitoring to protect both mother and baby. What causes diabetes? Several factors can increase the risk of developing diabetes, including family history, excess body weight, physical inactivity, poor diet, increasing age, high blood pressure, high cholesterol. Previous gestational diabetes. Symptoms of diabetes. Common symptoms include frequent urination, excessive thirst, increased hunger, unexplained weight loss, fatigue, blurred vision, slow healing, wounds, frequent infections, tingling or numbness in the hands and feet. Some people with type 2 diabetes may have no noticeable symptoms in the early stages. How is diabetes diagnosed? Doctors use several tests to diagnose diabetes. 1. Fasting blood sugar, FBS, measures blood sugar after at least 8 hours of fasting. 2. HbA1c test shows the average blood sugar level over the past 2-3 months. 3. Oral glucose tolerance test, OGTT, measures how the body processes glucose after drinking a sugary solution. 4. Random blood sugar test measures blood sugar at any time of the day. A healthcare professional interprets these results to make a diagnosis. Complications of uncontrolled diabetes. If diabetes is not properly managed, it can lead to serious complications such as heart disease, stroke, kidney disease, vision loss, diabetic retinopathy, nerve damage, diabetic neuropathy, foot ulcers, and infection. Increased risk of amputations. Keeping blood sugar within the target range can reduce the risk of these complications. Treatment of diabetes. Treatment depends on the type of diabetes and individual needs, but generally includes healthy eating, regular physical activity, maintaining a healthy weight, monitoring blood sugar levels, taking prescribed medications, insulin therapy when required, regular medical checkups. Best foods for people with diabetes. Healthy food choices include non-starchy vegetables, leafy greens, whole grains, in appropriate portions, beans and lentils, fish, skinless, chicken, eggs, plain yogurt, nuts and seeds, in moderation. Low glycemic fruits, eaten in suitable portions. Foods to limit: people with diabetes should limit sugary drinks, candy and desserts, white bread, white rice, highly processed foods, fried foods, foods high in trans fats, excessive refined carbohydrates. Can diabetes be prevented? Type 1 diabetes. There is currently no known way to prevent type 1 diabetes. Type 2 diabetes. The risk of developing type 2 diabetes can often be reduced by maintaining a healthy weight, exercising regularly, at least 150 minutes per week, eating a balanced, nutritious diet, getting enough sleep, avoiding tobacco use, having regular medical checkups, especially if you have risk factors. Is there a cure for diabetes? At present, there is no permanent cure for diabetes. However, many people can successfully manage their condition through healthy lifestyle habits, medications, and regular medical care. Some individuals with type 2 diabetes may achieve remission, meaning their blood sugar returns to a non-diabetic range for an extended period without diabetes medication, but ongoing medical follow-up is still important. Key takeaway: diabetes is a lifelong condition that affects how the body processes blood sugar. With early diagnosis, a healthy lifestyle, proper treatment, and regular monitoring, most people with diabetes can live long, active, and healthy lives. Medical disclaimer: this information is provided for educational purposes only and should not be considered medical advice. If you have symptoms of diabetes or have been diagnosed with the condition, consult a qualified healthcare professional for diagnosis, treatment, and personalized medical guidance.